The VA Center for Innovation invested in a new technology designed to track and improve the effectiveness of emerging treatments for traumatic brain injury, or TBI, which affects a growing population of military veterans who survive life-threatening injuries.
So our job in rehabilitation medicine, particularly in the polytrauma system of care, is helping very complex patients become people again, to cast off their diagnoses and to allow them to integrate back into the community and into their lives.
Our system that we used in the past just did not collect the data. So this is the first time we've ever used a program that strictly collects numbers and provides us with a means of whether we are doing the right things for our patients.
TBI Toolbox helps us do that by monitoring the outcomes of our programs, by monitoring very specific things that we know will help individuals once they get back in the community.
Well, the TBI Toolbox is a program that contains numerous measures that are used to evaluate outcomes for rehabilitation.
We wanted to be able to create a customized tool that could be used by doctors, clinicians, and even patients to enter in medical data that could help them speed up their process so paper forms wouldn't be needed any longer.
The patients that we've used this with, they seem to enjoy it. They seem to enjoy the fact that they are understanding that we're really focusing on not just how nice we are and how nice the place is, but taking a very critical, hard look at how well we're providing care.
At the VA Medical Center in Richmond, Virginia, the Polytrauma Rehabilitation Center uses the TBI Toolbox to gather, analyze, and share therapies for traumatic brain injury. They're now able to organize information about a patient, track and share that data across the team to reach consensus about the diagnosis and generate reports about the patient's progress. All done electronically for the first time.
It was offered to all of the clinicians as a means of data collection, and it really does help a lot with collecting our data for evaluations, follow-up evaluations, and sometimes even discharge.
We are using the assistive technology outcome measures, which are evaluation forms in the TBI Toolbox, to get the patients to be able to provide us kind of with a baseline of where they're at with using technology. And then once we provide an evaluation and an intervention, to see how effective we were in using that technology in their everyday life.
The single most important aspect of the toolbox is for our ability to bring quality monitoring and management to our programs, to know that our patients are getting better over time, and to know what we can do to help them get better over time.